Hi, my name is Dr. Ryan Murphy from Hosey Foot and Ankle Centers. I wanted to talk to you today about Achilles tendon problems. Most people have heard of an Achilles tendon and know somewhat what it is, but many people are affected by problems with this tendon. The Achilles tendon is a tendon that inserts on the back of the heel. One of the most common problems with the Achilles tendon is tendonitis. Tendonitis is caused by many factors. It can be an overuse problem where somebody starts to increase their activity level, or they start getting some pain with an increase in the activity level. Their foot structure can cause Achilles tendon problems. Foot structure, being a flat foot or even a high arch foot, can both cause problems with the Achilles tendon for different reasons. Most people also have something called equinus, and equinus is when the foot does not reach 90 degrees to the leg. This is a very common problem, and most people have this. When that happens, the Achilles tendon has to stretch just for the heel to touch the ground. Another problem is related to the surface for training for athletes. Certain athletes will train on uneven ground or run up hills or train cross-country running. These can cause problems with the Achilles tendon. Footwear can also cause problems with the Achilles tendon. Not having adequate support in your shoe gear can cause problems. Some of the treatments for Achilles tendonitis are non-steroidal anti-inflammatory medications such as Motrin or Aleve. Immobilization can be a treatment for Achilles tendonitis, and when you come into the office, sometimes we will suggest immobilizing the foot so that the tendon can rest and heal itself. Sometimes stretching can be beneficial in alleviating the Achilles tendon problems. Ice can help with alleviating the inflammation, as well as heel lifts in the shoes to take off pressure from the tight Achilles tendon. Sometimes when these treatments fail, we will suggest physical therapy for patients, and they will perform many physical therapy modalities to help alleviate the tendonitis. When this doesn't help, occasionally surgical treatment is indicated. One of the biggest things with Achilles tendonitis is to catch it early. If we can catch the problem early, then it's most likely that we will be able to treat it without having to resort to surgery. Some patients will wait for even a year to see if they can treat it themselves, but this makes it very difficult to get rid of conservatively. Another problem with the Achilles tendon is a Haglund's deformity. A Haglund's deformity is a bump on the back of the Achilles tendon where the tendon inserts on the heel bone. What happens with this is there's a bump on the back of the heel. This can cause, most often, rubbing in the back of the shoe. Most shoes have a back on them, and it hits in the spot where this bump is formed. When this happens, some of the conservative treatment options are the same as with the tendonitis. So stretching, ice, rest. Another conservative treatment for this is changing shoe gear to a shoe usually without a back, such as a sandal or a clog. Sometimes this can cause other problems in the feet, so you do have to be careful with this shoe gear change. When this doesn't help, surgical treatment is indicated. The surgery for a Haglund's deformity involves reflecting the tendon off of the bone, because the tendon is on the bone in the area of the bump. We reflect the tendon off of the bone, shave off the bump, and then put the tendon back on the bone with a new system of anchors to hold the tendon on the bone and return you to normal function and normal flexibility. The other Achilles tendon problem that I'd like to discuss with you is an Achilles tendon rupture. An Achilles tendon rupture can happen to anybody, but it's most common between the ages of 20 and 50, and it most often happens in males. Most often when this happens, people are playing a sport or an activity, and they feel that they have been hit with something from behind. Sometimes people relate that they feel a pop and a sudden weakness in the Achilles tendon. When this happens, you should seek treatment immediately for this problem. There's a few treatments for this. One is a conservative treatment where we place you in a cast for a variable length of time depending on the severity and nature of the problem. The other way that we treat it is we can perform surgery to reapproximate the tendon and put it back together so that it's just like it didn't happen before. again, the biggest thing with any of these problems is early treatment. Any early treatment will cause a significantly better outcome in the future. Thank you very much for your time, and we look forward to seeing you at Hosey Foot and Ankle with any of your foot or ankle problems.